Moderna.
Oh, you did?
Yeah. So, yeah.
Okay.
We will be recording this presentation, and VCHA will be happy to send it out to anybody who requests it, as well as we will be posting it on our website for anyone to download. So before we get started, what I'm going to do is I'm going to turn this over to Jonty Vega, who is with Ventura County Public Health. We thank him for his time, his effort, and his presentation he'll be giving us today. So Jonty, you are listed as a co-host. You should be able to share your screen and take it away.
All right, then thank you so much for that introduction. Let me just share the presentation here. All right, then. And let me know if you guys have any issues with being able to hear me or view the presentation. So thank you again, Amanda and Dylan, for reaching out to me with regard to this request. Just like what was mentioned, I'm John T. Vega. I'm one of the public health nurses within Ventura County and within the communicable disease program. I've been a nurse since like 2015, and my kind of area of focus is more so into infectious disease, communicable disease, and tropical diseases as well. And so, of course, the focus of today's presentation is going to be on infection control education and PPE specific to COVID-19. So just like what you guys have been experiencing throughout the pandemic, and what we've really come to understand is that the primary mode of transmission for the virus is going to be that close person-to-person contact, that less than 6 feet, 15 minutes cumulative or prolonged exposures. And although it is possible for people to say come into contact with like a surface, a table, a doorknob, light switches, etc., that say an infectious person has sneezed or coughed on or something of that nature, and then to perhaps self-deliver to their eyes or to their mouth and then become infected that way. It's not the primary mode of transmission, but this all does tie into all of the infection prevention and control guidance that we're given. And one of the key concepts within this that I think is so important to understand is what's referred to as the chain of infection, or how disease spreads. And so, of course, there are several portions of that chain that need to be in place in order to have sustained ongoing transmission and infection. And everything that we recommend, all the guidance that we provide, as well as what you guys have seen from the CDPH, as well as CDC, and other healthcare agencies as well, is meant to break different portions of that chain. Because if you break any portion of this chain, then you cannot have sustained ongoing transmission. And just to kind of go through a little bit of an overview of it. So of course you have to have an infectious agent. In this case, ours being COVID-19, that virus. And just as kind of like a sub point to that, if you guys do get questions concerning vaccination, the vaccine that we are mostly using, like at this point in time, between the Pfizer and the Moderna vaccines, they don't contain any viral proteins or viral particles or weakened versions of the virus itself. So there's no way, no how that a person can become infected from the from the Pfizer Moderna vaccines that we are currently using. So we wouldn't have an infectious agent here. And then, of course, there needs to be a reservoir. These viruses, bacteria, etc. They need a place to actually be in, to where they can replicate. And typically that could be people, it could be sources of contaminated water, contaminated food, or what's also referred to as like sylvan transmission as well. So for something like rabies, even though we vaccinate all of our pets, there are still wild animals that are reservoirs of that virus that continue on that transmission. And then moving on, you have your portals of exit. And this pathogen, it has to have a way of getting out of its reservoir or out of its host in order to get into the environment or to its next host. And so that comes into play with infection prevention and control in specific to COVID for what we refer to as source control or the universal masking. If we are stopping this pathogen from leaving its host through the use of those masks, then already we're breaking one of those links within the chain of infection. And then, of course, the mode of transmission, like what I mentioned on the previous slide, of it being that close, prolonged um, physical contact or physical proximity to another person. Again, with the use of the social distancing, we're also eliminating that possibility at that point as well. So already, two of the important links within this chain we're already breaking and preventing further transmission. And again, with the portals of entry, so our eyes, our nose, our mouth, those are all going to be the portals of entry specific to COVID. And when you guys are sort of going over this material with your staff members and then just anybody in general, that I think is also like another important aspect of them understanding how this is spread. So if they are making sure that they are washing their hands, that they're cleaning those surfaces, that even if they are say coming into contact with a surface, but if they have properly disinfected it and they're making sure that they're observing excellent hand hygiene, then and of course with the masking, and then specific to your staff members that are providing that direct patient care, also the use of their face shields as well, then we're eliminating again that possibility of further transmission. And then of course going on to the susceptible hosts. So all of us are susceptible. I mean, we with the use of vaccination, we are improving all of our communities' large scale immunity. That's what we refer to as like the herd immunity. So when we have that in place, then we don't have as many susceptible hosts. And we have a short video later on in the presentation that like really wonderfully illustrates that. Because of course, a lot of the people that are going to be highly susceptible to COVID-19, those persons that have immunodeficiencies, that might have things like diabetes, that might have skin tears, burns, something that uh, is breaking that initial barrier for them, or maybe if they've been weakened through a course of say a previous infection, or maybe they're recovering from surgery, and of course the very young and the very old, that 65 and up and that under 5 age group. And all of those, with the exception of the under 5 age group, are largely the population that that this um, that this agency is dealing with, and a lot of the clients that you all have in your various businesses as well. So then all of this coming in and tying together, that when we are doing things like masking, when we're doing the excellent hand hygiene, when we are utilizing the proper PPE in the proper way, and also with the screening prior to and after the start of a shift, as well as with the routine testing of those staff members and those symptomatic persons. All of this is coming together to break this chain of infection at various points to, again, prevent the further spread and transmission of the virus. Oh, and are there any questions just yet? No, no? Okay. So we'll move on to the next one. So we always say, this has been a very difficult year for just everybody across the globe. And if we can have some moments of levity, if you will, one of our partners in OES, Office of Emergency Services, does these kind of funny memes for us from time to time that we do share, with the community as well. And so I'm sure that you guys have seen people wearing masks in all sorts of ways, but we want to make sure, especially with our staff members and with our residents as well, that they are, of course, doing that source control. That's going to be one of the easiest things that we can do to not only protect ourselves but protect those persons around us as well. And just kind of going back over the universal source control. So, of course, whenever your staff are entering into the facility and while they're working on their shift, you do want to make sure that they are wearing a face mask. For healthcare workers, you do need to make sure that they are utilizing a surgical mask. And then if they're working with persons that are symptomatic or that have had an exposure or that are confirmed as being positive, that they do need to be wearing an N95 mask. You guys have probably come across it a couple of times with people having KN95 masks, and the KN95 masks are not going to be appropriate for working with those persons that are suspected, symptomatic, or confirmed positive. So you just want to be aware of that, making sure that you have the right PPE for them. And of course, the cloth face coverings are not going to be appropriate for working with any of your residents or patients. And ideally, whenever our residents are outside of their rooms, that they are also practicing universal source control as well. And this may vary in terms of compliance depending on the type of unit that you have. But again, you just kind of want to make it the norm and get people into the habit and the routine of using their masks. Any questions, Shashet, you guys? No? Okay, we'll move on to the next one. So again, another funny meme. And we have a short video here that I'll share with you guys as well. And just let me know if you can't hear it, okay?
John T, we don't see the video on our end. Not sure if you do or not.
Go back to here.
We see a bunch of seagulls.
Hold on just a second then. Okay, so I'll stop that for a second, and then I'll actually just share my screen overall. And okay, are you guys able to see this video?
Yes.
Okay. All right then. So I'll just start it back over here.
However, we can't hear it.
I'm sorry, you guys, can you hear it?
No.
Oh, let me see here. If I mute myself. Just one second. It should also allow for that share computer sound as well. Okay.
Fusion.
Okay. And what about now?
My name is Jay. I'm a registered nurse. I'm also a human who has a respiratory system. I'm wearing this
Yes.
pulse oximetry sensor to measure my oxygen saturation in my blood for oxygen infusion. I'm wearing a procedural mask, and I'm at the end of a 12-hour shift, so I've been wearing this mask pretty much consistently for 12 hours. As you can see, my oxygen saturation is 100% out of 100. I'm speaking at length with this mask. My oxygen is not changing. I'm on room air. That's one mask. I now have 2 surgical masks on. Oxygen saturation is back in my baseline of 97, 98, up to 100. 2 masks on. Jason again, still have the pulse oximetry sensor on. Oxygen saturation, 100% with a good waveform. Clearly, this is not impeding gas exchange. 3 surgical masks. I do not feel short of breath. 100%. So I'm now wearing a nasal cannula with no oxygen attached. But the reason it looks this way is because it measures end-tidal carbon dioxide output. As you can see, my normal range is 42, well in the acceptable range, but I also don't have a mask on. Let's put 3 masks on, since some people think it causes CO2 retention for whatever reason. I now have 3 surgical masks on. I'm measuring my oxygen saturation and my CO2, my end-tidal CO2. As you can see, my end-tidal CO2 is 41, well within an acceptable range. My oxygen saturation, not on supplemental oxygen, I'm still on normal room air, is 100%. Wear your mask. You do not have a reason to not wear a mask at all. Hi.
Okay. All right, you guys. And so, of course, earlier on in the pandemic, of course, we did have just a whole variety of different scenarios that we encountered, and of course, one of those being people for various reasons having issue with the masking. And so that's really just there to kind of highlight one of those points of people for some reason saying or being concerned about CO2 retention, which we've come across here and there, and really there's just not really any evidence to back that up. But also just what you guys were seeing there with the use of multiple masks. Within the facilities themselves, we still really are just recommending just the use of just their one mask, no need for like a double masking, and certainly not for if the person is wearing an N95 mask, for them to wear an additional mask over that, and certainly not underneath it. Because of course, with the use of our N95 masks, the way that it's providing that protection to us is by having a good seal close to the skin. And if that is being disrupted, say because the person has a beard, or because they're wearing another mask underneath it, then it's disrupting that mask's ability to provide that higher level of protection for them. And that's something that even at this point in the pandemic that we still do see at facilities. And so it is a point to just be mindful of whenever you're in your different facilities, again, for the proper usage of that PPE. Even though I know that in talking with those staff members that they feel like it's protecting themselves, just that again, making them aware and understanding of how is the PPE that they're using actually protecting them. That way they can correct those habits. Any questions just yet, you guys? All right,
I'm
cool.
so
I'll move on
sorry.
to the next one. Yes.
I don't know if could you please repeat that N95 thing, because there was a break in communication. I don't know if it's my system or maybe we couldn't hear. Could you please repeat that N95 steps? What's safe?
Yes. So for the use of the N95, the way that that is providing protection is by creating a good seal close to the skin. So in order for it to actually be able to do that, it can't be interrupted by, say, a person having a beard. So of course, people that have beards, they need to shave. And if for whatever reason they're not able to do that, then you need to figure out a different different form of protection for them. Maybe something like the use of like a papper for them, and making sure especially that the staff, whenever they're using their N95s, that they're not wearing another mask underneath it. And there's no reason for them really to wear another mask on top of that if they're using, say, a face shield, because that face shield is already going to be protecting their N95 from becoming splashed on or anything like that when they're providing care.
And the KN95, you mentioned something, and again, there was some break in communication. The KN95, how would you rate these masks? Are they as
So
good as?
you can use a KN95 for the same situations or the same way that you would use a surgical mask. If you have a person that is symptomatic or that has been exposed or that is confirmed positive, then only the use of the N95 mask is going to be acceptable for them. The KN95 mask will not be appropriate for those types of patients.
And last question, I remember myself trying to feed the mask and trying not to smell whatever smell goes around. And in some instances, really, some things are not going through and some smell goes through. So does it mean that the mask is not certain smell could be different from another? Is there any criteria there?
So if I'm understanding correctly, then each one of the different styles of masks, they're going to fit a bit differently. And so if you guys haven't already, then we do recommend, and I believe it is part of the OSHA guidance for like, for you all as well, to make sure that your staff are properly fit tested for the use of their respirators. So there's a bunch of different styles out there, and you have to find out which ones are going to be appropriate for that particular person. Again, say this person has they have a beard, and then like none of the N95 or rather none of the respirators fit properly for them. So then you'd have to use something completely different. Again, say like a PAPR for them. Or even if like you gain or you lose a noticeable amount of weight, then that can also change what respirators might be the appropriate fit for you. And if a person is like reporting kind of like a loose fit or anything like that, or like a lot of smells like getting through their mask, then certainly it would be an idea to probably have this person refitted or retested. And to that point, one of the easy, quick ways that we do recommend for staff making sure that the type of respirator that they're using is appropriate for their face shape size is what's referred to as a seal check. And essentially, that is when they are using, when they're initially putting on this respirator, that they exhale. And then if they're seeing or feeling any air escaping from around the sides, then of course there is not a good seal there, and ergo not the highest level of protection available for them. So then they'd want to pick a different style or a different size mask.
Yeah, thank much. So you believe that the smell is okay, not like strong smell, but in general, it's okay if the smell goes through the mask.
So again, that's going to be the purpose of when the initial fit testing is being done. So they do come with at least two different scented agents, and then if either of those two agents are getting through the mask itself, then again we know that there's some issue going on, and whatever respirator that they're able to still smell that agent through is not going to be appropriate for them. So if your staff are reporting that they're still getting like, a lot of smells like through their mask, then that is definitely something that you want to revisit and to see if there's not a more appropriate sized or style mask for them.
Okay, thank you so much.
Mhm. Okay. And so then we'll move on to stellar hand hygiene. So this is going to be one of the best tools, like, in our arsenal here of making sure that we are practicing this consistently and very thoroughly. Um, we should always be striving for 100% hand hygiene compliance. And this is not just for COVID, because of course, in the settings that our residents are in, there are a whole host of communicable diseases that they can get from poor hand hygiene process. I'm sure you guys have probably been like, deathly concerned, whenever you've heard about a facility having, say, like a norovirus outbreak, or especially if there's like, say, like a C. diff outbreak, if you will, both of those are going to be areas of concern to where we want to make sure that there's a excellent hand hygiene practice going on. And with this, whenever myself and the rest of our team is kind of going out and trying to assist different facilities. This is one of those key areas that like we do look at, because if there's poor hand hygiene practice, then it's something that's going to really need to be addressed if we're going to prevent any further transmission. And we really kind of want to encourage this um, to be kind of something that all of the staff members feel comfortable with and addressing, because of course, the administrators and other people within management and supervisors, you're not going to be able to be around 100% of the time, and we want to have it as part of the culture and part of the individual practice of using hand hygiene. Um, Oftentimes, we've seen that sometimes staff will just try to wear gloves, and they'll just wear gloves like wherever they go, and they don't change their gloves because again, probably from their standpoint, they're thinking that they are protecting themselves by wearing the gloves, but that would still be improper usage of that PPE, because the gloves, they need to be changed between each individual use. And you need to perform hand hygiene before and after using them. So if you're just going around touching everything with those gloves and thinking that you're protecting yourself, you're really just spreading pathogens everywhere, and you're probably still going to touch your face. Many times we've seen people touching their face, using their phones, etc., while still wearing these same gloves that they for whatever reason are thinking are providing them with that protection. So it really is best to have that good, consistent, stellar hand hygiene practice. And again, we want all of the staff to feel comfortable with that, to to be able to say to one of their coworkers, hey, I saw that you came out of so and so's room, there's some hand sanitizer right there. And so that way, again, it's not to sort of berate or harp on anyone else. It's just a matter of kind of collective action and collective responsibility. So that way you're keeping your other coworkers safe, you're keeping yourself safe, you're keeping your patients safe. And really, that's what we are striving for at the end of the day. And we want to give everybody the knowledge and the tools to be able to do that. So again, making sure that that staff understand the importance of that and that it is a part of their individual practice, and making sure that it's available to them. If the staff members, if they have to walk all the way down the hallway just to get to like a hand sanitizer pump, then they're really going to be disincentivized from having good practice. As much as it's feasible, say having hand sanitizer available either in the patient's room or outside of their door, or even giving staff members their own individual bottles of hand sanitizer, so that way they can use it whenever they find that they need to. I've talked I always do like to express that we want to make it as easy as possible for people to have good practice, and making those supplies readily available is going to go a long way in that. Any questions on that one, you guys? All right, move on to the next one. And so social distancing. So also play this video for you guys too. And again, let me know if there's any issues with being able to hear it or see it.
When does a car become more than a car? Introducing Burgers, the all-new Burgers Supercharged Burgers.
When all you can burgers is think about Postmates. For $5 off your next 5 orders, use promo code BURGERS.
Measles is one of the most contagious diseases we know. Just one person is likely to infect between 12 and 18 people. That number is called a disease's basic reproduction number, or R0. Scientists use it to describe how contagious a disease is. Zika, it has an R0 of up to 6.6, super contagious. But the seasonal flu, just a little over 1. And COVID-19, the disease caused by the coronavirus, just about 2. That difference between the flu and COVID-19 doesn't seem so big, especially when you look at them next to these really contagious diseases. Plus, a lot of the symptoms of the flu and COVID-19 are really similar. A fever, cough, they can even both lead to pneumonia, which is ultimately how they can both be fatal. So thinking of COVID-19 and the flu as similar is a common and frankly understandable comparison to want to make.
This is like the flu. It's a lot like the flu.
I like to believe that it's going to end up more like the flu virus.
But wait, let's go back to those R0 numbers again. If the flu has an R0 of 1.3, that means each person gets either 1 or 2 people sick. After 10 rounds, that's 56 total people. And if we run the model with COVID-19's R0 at 2, if one person with it gets 2 people sick who get 2 people sick, after 10 rounds, that's more than 2,000 people. This does not happen with the flu, because COVID-19 is very different. And understanding how is crucial to understanding how dangerous it really is, and why we have to take it so seriously.
When we start to look for that comparison to the flu, we almost calm ourselves down. But unfortunately, that's not quite the right reaction here.
Every year, the seasonal flu kills as many as 60,000 Americans. As of late March, COVID-19 has killed about 34,000 across the whole world. But scientists expect that number to go up, way up.
Tens of thousands of people a year die of the flu. But we haven't had this for a year yet. We've only had this for a few months. The trouble is coming, and we can predict it, and we can see what's coming, at least to a certain extent.
The first really big difference between COVID-19 and the flu is how long it takes you to feel sick. From the moment you're infected with COVID-19, it usually takes 5 days before you start to feel symptoms. But it can take as long as 12 or even 14 days. This is the incubation period, the time between when you catch it and when you first realize you're sick. And scientists think you could be contagious during most of this period. The flu, by comparison, has an average incubation period of just 2 days. You get sick, and pretty soon you feel sick, and you know you're contagious. This is what we're used to. But COVID-19 flips that around. You can be contagious and spreading it around for several days and up to 2 weeks before it even occurs to you that you're sick. And that leads to the next big difference.
No human immune system had seen this virus before. Nobody has a natural immunity to it.
In flu season, there's always a number of people in the population who are already immune to the flu. That can be because they got their flu shot, or maybe they've already had that flu strain. And that limits the spread of the virus. When one person is contagious with the flu, they can only spread it to people who aren't immune, who can only spread it to other people who aren't immune. That's why scientists and doctors urge us to get our flu shot every year. If enough people have immunity, they can kind of shield the virus from reaching others. The more immunized people, the more they can protect those that are susceptible to the virus. But COVID-19 is brand new. None of us have had it before, and there's no vaccine, which means nearly everyone on the planet is susceptible. So when a contagious person, who may not even know they're infected, comes into contact with others, it can spread like wildfire. And then you see how much more dangerous COVID-19 can be. Only 2% of people with the flu need to be hospitalized, but 20 to even 30% of people who test positive for COVID-19 do. And we're still learning about COVID-19's fatality rate, but scientists think it's somewhere between 1 and 3%. But the flu's rate is even lower, 0.1%. And that's a disease that can kill 60,000 people a year in the US alone. That's what Dr. Anthony Fauci, the US's leading infectious disease expert, tried to clear up to Congress.
People always say, well, the flu does this, the flu does that. The flu has a mortality of 0.1%. Sure. This has a mortality of 10 times that. This is a really serious problem that we have to take seriously.
And he's just talking about the average across all age groups. For older people or people with compromised immune systems, it can be way higher. And that's especially scary when you remember all the other things that are different about COVID-19. The infectiousness, how hard it is to know you have it, how susceptible we all are to it. Estimates vary, but some scientists have warned that between 20 and 60% of the world's population could become infected with the virus. Because COVID-19 has no cure and no vaccine, the only defense we have against it is social. We can take ourselves out of the chain, not with immunity, but with social distancing. Just physically not being around anyone and staying home as much as possible. But that only works if each of us takes it seriously, which is why comparing it to the flu, while understandable, is not helpful.
It's natural to want to find a comparison, to want to make this seem small. When we use the flu as the backdrop, it almost numbs us, or it can numb us and make us maybe even feel better about the current situation, because the current situation is bad. So now is not the time to be numb. We need to be vigilant and then use our vigilance for useful actions.
Yeah. All right, then you guys. And so we'll continue on with the slideshow here. And so just to kind of continue on that point of the importance of social distancing, the video, of course, is a little dated since we do now have a few vaccines, a few more tools in our toolbox to combat the virus. But the importance again of that social distancing and not minimalizing or making kind of false equivalencies to something like the flu really do go a long way. And again, making people understand the importance of each one of these things that we're asking them to do that go so far into breaking, again, that chain of transmission. And, there throughout the pandemic, like just that social distancing and what like the isolation that a lot of people have felt, especially for like our residents, is something that we come back to time and time again. Nobody is really expecting for you to or like any other person to just kind of stay home and shutter their windows and their doors and to never leave. Like, you know, there will be times where you will need to go out to like get groceries. You may be the the sole income earner, like, you know, in your house, and so you have to go out to work. And then now, like, you know, what we're seeing with some schools being open and some people maybe not having the option of doing online schooling anymore, and like, you know, having to take their kids and get them to school and what have you. Um, each one of the activities that like we do, they do come with a certain amount of risk, and especially for our staff members, you know, they have lives outside of like, you know, outside of their work, and they have other responsibilities, and we want to make sure that that whenever they are outside of the facility, because we can't control those actions, that hopefully they have a better understanding of the level of risk involved with anything that they're doing, because the stuff that they do outside of work is going to affect the people at work and the people whose care that they're entrusted with. Okay. And getting a bit more into the PPE aspect. So this you guys obviously can see is coming from the CDC. And so the PPE that is going to be appropriate for working with a patient that's either symptomatic, that's suspected as having COVID-19, or that's been exposed, or that is confirmed positive and under isolation, then the appropriate PPE for working with that type of patient is going to be a face shield or some form of eye protection. You guys, you do want to pay attention to this portion. There's kind of like a facial trauma style of glasses that I've seen that are kind of popular. They look really cool, but they don't provide that good level of protection that is going to be needed. Again, it kind of comes back to this idea of like having like a good seal. So we more so recommend the use of a face shield that has kind of like a foam bar going across like the forehead portion. So that way, you know, if the person is bending down or something like that, and say if the person are working with coughs or anything like that, that these particles are not going directly into, like, you know, the eyes, mucous membranes, and again, becoming a portal of entry for that person. Um, Goggles that provide a good seal all the way around the eyes are also acceptable too. And as far as face masks, then again, for this particular subsect of patients, you want to make sure that you are using an N95 or appropriate respirator for that. And then, of course, the use of gowns and gloves as well. And that should be sufficient for whenever you're dealing with these patients. There's no need for something like the booty covers or like hair nets or something like that. If you're worried about just like those areas being like, you know, being exposed for COVID in particular. Uh, any questions on that one, you guys? Okay, and so we'll move on. You guys, hopefully, you've already been working with your staff over their training and how they understand putting on as well as taking off their PPE. A lot of the times throughout the pandemic, we've come across kind of two major areas where staff might become inadvertently exposed or self-infect, and one of those being whenever they're removing their PPE. So they want to make sure you want to make sure that they are following through each one of the steps of removing the PPE. This should be something that's done sequentially and that is done with, like, you know, with attention to how they're doing it, because we don't want for them to say whenever they're taking off like, you know, whenever they're going and like they're taking off their gown, that they end up touching the front of their gown, and then they don't perform hand hygiene, and then say go and have their lunch or like rub their face or something like that, and then now they've inadvertently exposed themselves or self-delivered to their eyes, their mouth, their nose, and what have you. It's kind of like at this point, you just want the staff to understand that it's okay to slow down and to take their time whenever they're doing this. There's no need to rush. And we did put together a short little video here that I'll also play for you guys. And so that was my teammate Amanda there doing that demonstration. So she did a great job. Really happy about that one. And just like what you guys were able to see in the video there, the making sure that the staff are again doing that hand hygiene between each one of those steps is also going to be very important too. There may be a time whenever they're going to say like removing their gown or what have you, and to say it touches like their forearm or something like that. You know, they don't need to freak out about that, like because they can still use hand hygiene and in order to remove any pathogens that might have gotten on them at that point, which again just really highlights the importance of taking your time, and also again with the hand hygiene between each one of those steps. And kind of also to this point, the other area that we see that has been an area to where staff can become exposed is whenever they're having their breaks. Whenever they are going and they're going to take their lunch or something, obviously at that point they're going to take off their mask, and they're going to be touching things that they're going to be putting into their mouths, etc. And you want to make sure that again that for the area that they're going to be taking their breaks in, that you're making it as easy as possible for them to do the things that we want them to do. We want for them to be able to clean their their PPE that they're going to be using for for the remainder of the day, being their face shields and their masks or respirators, and so providing an area for wherever they're going to take their breaks to where they can disinfect their face shields, and say giving them like a paper bag at that at that station as well, so that way they have a place to store their mask and they're not having to put it on a table or something like that, and having the cleaning supplies there, so that way before they sit down as well as after they're done using that space, that they can clean it. And of course, just making sure that the staff also understand that their PPE, it's something that should only be being used at the facility. It's not something that you want for them to take home. And so providing a space for them to store those things whenever they're finished with their shift. And of course, we always like to be mindful that this pandemic, it's been just absolutely insane, and it's been very daunting for all sectors of society, especially for the healthcare workers. And just to remind yourselves, your staff, as well as our own colleagues here, that you guys, you're not in this alone. You do have entire networks of people that are out there thinking of ways that we can provide support, and trying to hear our community partners for again for those areas that they need support in, because in order to really stop any of this transmission within our communities, we do really need you guys, and we need your we need your staff to be healthy as well as confident in their ability to provide care and to be safe whenever they're at work. And of course, we really do want to thank them for all of that effort that they've been putting in throughout throughout the course of the pandemic. And this is kind of my team here. We're missing a person. Have Amanda, I'm sorry, to where we have Marissa in here as well, so that way it's all of us together. And lastly, since we do have the vaccine available, and likely you guys have already started to vaccinate your residents as well as your staff members, that getting as close as possible to that 100% compliance with the vaccination is really going to go a long way in protecting all of our communities. And if you guys are having any difficulty with getting your residents vaccinated, or your staff finding a place to where they can get their vaccinations, then do feel free to reach out to us, so that way we can see what what services we might be able to offer for you all. Okay. And that's going to be the end of my presentation there. Any questions, you guys, or anything at all?
Jonty, there was a request on the longer video you showed that gave the origin and the background and on COVID-19. And there was a request from the group to put the link to that in the chat. Are you able to do that?
Yeah. Let me see here. We're going to copy that link. And then when I go over to the chat here, okay. All right, everybody. And then that link to the Vox video for the kind of explaining the concept of the R naught, like getting into epidemiology, like so great, so cool, of how that rate of transmission, and so well as not making that false equivalency again between COVID-19 and something like influenza. So that's available for you guys in the chat.
Fantastic. Do we have any questions from the group?
Yes, please. Is it possible to have the slideshow emailed, or the PDF itself to be emailed to group, or maybe we can get it somehow through the link?
Mm-hmm. Yeah, and I think it should be fine if you guys want to share this, Amanda or Dylan. So yeah, this is what we use to, like, typically whenever we're doing kind of some community education like this.
Jonty, are you okay with me sharing the presentation in its entirety, or are there certain things that you want
It
to
should
look
be
at
okay.
first?
Yeah,
Okay.
just don't
appreciate that.
alter our pictures.
No, we would never take the seagulls out. Love them.
Is it possible to enlarge the graphics and post it around the place of work where we are?
Some pretty flowers for me.
Which graphics are you looking to enlarge?
Whatever slides we can
say
enlarge.
for like the PPE.
Anything like.
Yeah, you guys, you're certainly able to do that. I think if you print out like the entire, like if you print out like one slide per page, then it'll probably allow you to fit it to that, like that page size. And then a lot of the pictures that like we use are also available from the CDC as well.
Okay. Thank you.
I can drive you. Drive.
Okay. Any other questions yet, you guys?
If people are struggling with getting PPE still at this point, do you have any recommendations?
So if they are really not able to actually get the PPE through their normal vendors, then they can reach out to the Office of Emergency Services and place an order through there. And let me see. I'll stop sharing my screen here for a moment and then put that link into the chat as well, so that way people can also be able to see that. Yeah, and essentially you would have to place an order with them, and then you would come to their office in order to actually pick that up.
Where are their offices located?
That's going to be at 2240 East Gonzalez Road. Okay, let me do this. And we'll copy hyperlink. And there you go.
Wonderful, thank you. Any other
Mhm.
questions from the
And they
group?
and they do ask you guys that you make at least 3 attempts through your through your normal vendors before reaching out to them, because of course, like people throughout the county might be requesting from them, and so we want to make sure that we're properly utilizing the resources allocated to us.
Wonderful. John T., we really want to thank you for your time, this information. I think many of us had little pieces of it, but not the whole big picture. And I think for me, definitely the comparison to the flu and how one's in 10 steps spreads to 54 people versus the other one spreading to over 2,000 people, or those numbers were mind-blowing. So thank you for that
Yeah.
reminder.
And
No, you're very
the
welcome on that.
videos.
Like it's a concept that I as a person that's like interested in infectious disease am like always like kind of looking at what is the infectious dose of of this pathogen, what is the R naught number of it, and just kind of seeing that seeing that difference in terms of like, wow, this thing is like a super spreader by comparisons.
Yeah, the difference of 1.2 to 2 sounds really small, but when you quantify it out, mind-blowing.
And the video where you're showing how the masks reduce or not reduce, do not reduce the oxygen intake, how practically doesn't change anything. So it's really amazing, just because a lot of time people, it's perception. They think that they are suffocating just because they have a mask. They have a mask on them, but in reality, that doesn't prove anything happening to you. So that's amazing videos. And if it's possible to have these videos in our arsenal to show, especially our clients, because that's where the main roadblock is, because they believe whatever media they listen to, which says, oh yeah, you're gonna get sicker if you wear a mask because of the you breathing your own carbon,
Yeah, and that one is just like, no,
Yeah.
you guys, that's not how that works.
Right, and it's for us.
Just like what you guys have probably experienced, and I had the same experience like at the beginning of the pandemic, that wearing the mask is like uncomfortable. You may get used to it, and then maybe later on you get unused to wearing it, and then you have to kind of get used to wearing them all over again, especially for our staff members that are having to use their N95s, because those do need to have a pretty tight seal. They can be very uncomfortable, especially if we're going to be wearing them for an entire shift.
All right. Thank you very much. Really informative, and we appreciate it.
No, thank you guys.
So I want to thank everybody for their time. This presentation recording will be available on our website, which is vchainc.org. And you'll see it under, I think it's under, there's a COVID-19 tab. So if you have any questions, you can always reach out to myself. My phone number is on the website. And John T., again, we cannot thank you enough for your time and information.
No, thank you guys for reaching out, because definitely we want to make sure again that all of the community has has access to this information, to this education, because knowledge is going to be one of our best tools in our arsenal. And again, that's the point of public health, to be able to provide services like this to our communities.
Wonderful.
Oh, and thank you guys as well, for the work that you do, because having to be responsible and provide care and protection to sometimes several hundred residents at a time is not an easy task at all.
Well, thank you, everyone. We'll get everybody loose. Hopefully everybody gets a nice, relaxing lunchtime. And if there's any questions, please feel free to reach out to VCHA or Ventura County Department of Public Health. So have a great afternoon, everybody, and we'll see you at our April presentation for from Dr. Susky. So thanks, everyone.
All right. Thank you so much, you guys. Stay well.
You too.